How are some health units already taking bookings, but we are waiting for the province? Why is our schedule different from other areas?
So each of the 34 health units has a plan to immunize their community, and it's certainly dependent upon the supply of vaccine. There are some communities in Ontario that have been prioritized due to a high risk of infectious disease in multiple settings. So if you recall, Toronto, Peel, York, Windsor got a higher amount, an earlier amount of vaccine, in particular for their long-term care facility settings and high-risk retirement homes. As well, Ottawa got additional early vaccine. Because we have remained a low-risk area, we weren't prioritized, but we have started to receive vaccine because the province has given us all 34 health units a directive to immunize the long-term care facility patients first, and then the essential caregivers and workers. So please bear with us. Yes, there's a limited supply. We have fulfilled our obligation in our mission to put first doses into the arms of all patients in our long-term care facilities, high-risk retirement homes. We're now moving to the second doses. We are following the provincial directive to the T, which aligns very nicely with the ethical framework which guides our principles and how we approach this. So please bear in mind our first priority is long-term care and high-risk retirement homes. We have not given the second doses in these settings yet or completed that mission. We've certainly completed the first part of the mission. And this is the next phase of our work. We will then be starting in the next week or two our highest risk healthcare workers, so those workers that are actively exposed to COVID-19 patients working in intensive care unit settings, a COVID ward on the hospital and or the emergency department. We then will be trying to immunize as many as we can of over 80 individuals in retirement homes, and we will be going to those homes to vaccinate. We've also been given a mission to immunize First Nations Inuit Métis population in particular if they're going to be going north, and that is part of this first phase plan, and adult recipients of home care. So this is our first priority. I don't want anyone to think that any of the vaccine is staying in a freezer anywhere in KFL&A. We are actively putting needles into arms and increasing the protection of our community and not holding back any doses. By March 15th, we do think the vaccine supply will increase. There will be equitable distribution going forward across the province, and we'll have a regular supply. There'll be an online booking tool, and if you can't use the online booking tool, there'll be a customer service call center that is operationalized by the ministry. Both of these products are the ministry products that we're waiting for them to be able to be available to you. So your family physician can't book you, the pharmacy can't book you, nor can we. It will be an online booking tool once our mass clinics are operational. I can further explain our mass immunization strategy, but I think it's quite robust, and we can vaccinate on any given day without any significant stretch 7,000 people a day. So I think we'll be able to immunize our community rapidly once the supply improves.